This month, people are honoring Breast Cancer Awareness Month. Despite having a lower incidence rate of breast cancer compared to white women, Black women are 40% more likely to die from the disease than white women.
That data comes from the American Cancer Society. Now, Local 5's Larissa Millis spoke with a Des Moines oncologist and a breast cancer survivor about why addressing and reducing that disparity is so important.
Cheryl Leverett still remembers the day so clearly.
I found a lump in my breast on my own, and you don't really want to believe that it is. So I asked my husband, tell me if you feel anything. I didn't tell him which breast or anything, and he felt the same lump.
That was in 2012, just a few days after her 47th birthday. Cheryl was later diagnosed with breast cancer.
So I was really concerned about my family living without me.
2 weeks after her diagnosis, Cheryl's family got more devastating news. Her younger sister, Valerie, also got breast cancer. Just 3 months later, Valerie died at just 43 years old.
At her funeral, I went bald-headed. And I was like, you know what, I'm not going to be ashamed. I'm going to go. This is kind of like a salute to her, just to let her know that I'm going to fight. I'm going to continue to fight. I'm fighting for you, me, and anybody else that this disease touches.
Finding strength through pain, Cheryl went through chemotherapy and sought support.
Well, I went to a lot of different events for cancer, and a lot of times I was the only Black person there. And that made me sad because I said, I know there's somebody else that's going through this same battle.
Dr. Susan Beck with Mercy One Katzman Breast Care says many barriers exist between Black women and proper care. She believes that's leading to higher rates of death from breast cancer.
There are a lot of places that don't have quick or easy access for mammography. There may be insurance issues. Sometimes it's that. Sometimes it's perceived as well. Sometimes it's just scary. There is a barrier of mistrust and fear.
Beck says providers can do more to close the gap, like connecting with Black women leaders in the community. A good way to do that is through organizations like Black Women for Healthy Living. Cheryl is a part of that group and has shared her journey through their work.
We continue to fight, and I do a lot of stuff to kind of let people know. The sad part is sometimes Black Americans, they don't talk about it. They don't get the care they need.
She hopes in sharing her story, other lives can be saved.
I've lost my sister to this. I don't want anybody else to die or to lose a family member to it. And so if I can help save one, I feel like I've done my job.
That was Local 5's Larissa Millis reporting. Now, Dr. Beck says physicians are working to get more mobile mammography units in the region and expand their use to more rural areas as well, so preventative care is more accessible.